Dr. Kader, NIHR, the Health Foundation, WAIRA, Innovate UK, Dr. Care Anywhere, obviously, and the Beacon Practice. So, like, how did you manage to get involved with so many different organisations? I know a lot of this was as part of a portfolio of activities you were doing.
Yeah. So I think a lot of it is about not being afraid to take, or even if they start off as small opportunities, if you have capacity and you've got an interest, to sort of dip your toes in and get involved. So with a lot of those things that you were talking about, some of them, I guess I was introduced by my work in clinical research. Other things you might see advertised in normal sort of press that's pushed out through your sort of local deaneries, local faculty.
So were any of these advertised, or were they as a result of your network?
So probably a mixture. So I guess Health Foundation is quite a big one. That's normally, they work quite closely with the Royal Colleges and faculties such as that. They also are really linked in with local academic health science networks. So part of my clinical research, the academic health science networks have a sort of close relationship with that. So I guess they've been set up to help introduce new technologies, new ways of working into the health system, into the NHS. And certainly, if you're looking for opportunities, I think linking in with your local AHSN, there's lots of opportunities there as a GP. Linking in with your local clinical research network is really important. And certainly your local sort of faculty associated with the Royal Colleges also has lots of opportunities. So it's not just through who you know, certainly.
As for those that don't know, what does AHSN stand for?
Academic Health Science Network.
Brilliant. And so, I mean, one of the questions we have is how, as a GP, how can you as a GP redevelop or specialize, or gypsy even, into digital health? Like, what does that look like, and how do you get started? I mean, you described some things already, but what advice would you give? Because I mean, we have it all the time where we have, I mean, any doctor, how do I get into digital health? How do I specialize in digital health? Where do I get started? What would you advise?
So for me, I guess there isn't any sort of formal accreditation from a sort of GP with special interest at the moment, but that doesn't mean you can't start.
You think there should be one? What do you think?
Yeah, for me, I think getting involved in digital health, especially in the last year, I don't think, it depends to what level we're talking about, but I think digital health is just part of core primary care now. So
eventually it'll just be health again, won't it?
Yeah, so I wouldn't necessarily say, I think every GP who is qualified has got the capability to get involved in digital health. It's not, it's very inclusive, it's not restrictive at all. I think the great thing about GPs, we have developed the skills and experience to adapt and flex. We already do that day to day in sort of conventional models. We've used in-person stuff, we phone, we manage risk. That's the great thing about general practice.